on this was it is was a signature moment where Speaker Paul Ryan and Senator Patty Murray from different parties came together and said, despite our ideological differences about the size of government and prioritization, we agree that we need better data and evidence to make our decisions. And they established, through legislation, a commission, 15-member commission, to look at how the federal government could increase its capacity to use data and evaluation to make better decisions. And there was, of that set of commission members, there was a core set of privacy experts who were there to make sure that whatever the recommendations were, people put privacy at the center. And fortunately, they were able to come up with a unanimous set of recommendations that it's in a report. I should wave it around. Green copy, you can find it on the web. The Promise of Evidence-Based Policymaking. And in that report, there was a central premise that drove all the other recommendations. And that central premise was, it is possible to share data and protect privacy at the same time, thanks to a lot of new technologies developed in the financial industry and by research institutions that enable that to happen. So one of the great things about the report, which you'll find, is there were proof points. There are existing things out there that they were able to point to that met those privacy standards. So for example, at the Census Bureau, there's been an organization around for some time called the Center for Administrative Records and Research Applications. And it was a little-known center that was helping the Census Bureau carry out its obligations to provide information about the condition of the United States by bringing in administrative data that sat in other federal agencies or in state and local governments, or sometimes the private sector. And they brought it together and they figured out how to link it in a privacy-protected environment and produce aggregate statistics that were high value to the public. Well, that same organization got on the radar of OMB, who said, hey, we want to start using this data linkage platform to support program evaluations being conducted by other federal agencies and potentially by state and local governments. And it also got on the radar of the Commission for Evidence-Based Policymaking, who used the kinds of projects that CARA was doing as use cases and examples for why we should expand this effort. Another example is something called the Administrative Data Research Facility. So this is a platform, a cloud-based technology platform, data linkage platform, that was developed collaboratively between the Census Bureau and the New York University. A woman named Julia Lane spearheaded this. And what that platform can do is enable you to link data from local, state, and federal programs, or within a state or locality, lots of different sectors. And in addition to creating the platform, what they wanted is they wanted people to know how to use it. So they coupled the creation of the platform with a training series. They're now, I think, in their second year, but they've done quite a few workshops around the country. And as one example of what came out of it, the state of Illinois had sent a team of folks to try to tackle questions of recidivism and how to improve employment outcomes and health and human services outcomes for people leaving prison. And when the team comes, they bring their data sets. So they learned how to link data across tax, workforce, the correctional system, and health and human services to begin to understand what are the factors that contribute and really create a platform that could be used for analysis and evaluation. And Illinois has now licensed the use of this platform for 5 of its agencies on an ongoing basis. So you can do this too. If you gather people together who have successfully navigated these issues of how to share data, there's some central principles that always emerge. So first, you have to establish the clear benefits to the data owners. There's a couple ways to do this. One is to get to somebody really, really high up in the organizational hierarchy. Like, if you can get the president or your agency head to see the value of doing this and tell you this is a priority, hey, you can make your boss happy. But the other way, because a lot of issues can't, penetrate the higher ups. So the other way to do it is to make sure that when you're asking somebody for data, you're getting in their shoes and you're saying, what would be the benefits here of bringing this data together where, in addition to me getting something, I help you get something useful. So keep that in mind. The second thing is you have to put privacy and confidentiality at the center. Make sure you have a secure, foolproof solution. And when you do, you can get things through the lawyers. It may take a little while, but you can do it. So ultimately, everybody who has done this stuff has stories to tell. And we're going to hear some stories from this group. I want to share one story of something that I was involved in that has, I think, lessons for a lot of other areas, but it was kind of a big deal. So I worked on higher education programs for many years. And I'm curious whether you are familiar with something called the College Scorecard, which is now up on the Education Department website. Just show of hands, how many people know what that is? Okay. Not enough of you have kids about to go to college. So the scorecard is a place you can go and you can learn about an institution, some basic factors about whether it's a 2-year or 4-year college, what programs it offers. But there's a new piece of data that's on the College Scorecard for every school that participates in the federal financial assistance programs. And it is the average or the median earnings of students who were borrowers of federal financial aid 10 years out. So, you want to look at Harvard or you want to look at Riverside Community College. It'll tell you the average earnings regardless. And while that's now there for every school, for consumers and families to use, the impetus for that happened back in 2009, 2010. When President Obama wanted to crack down on unscrupulous trade schools who were charging exorbitant amounts of tuition, marketing their services to low-income individuals by saying, I'll get you a high-paying job, you just have to sign right here for this $30,000 loan. And they needed a way to distinguish who were the bad actor schools from the good actors, and they had a concept of debt-to-income ratio. Well, to get the answer to that by school, you needed to link the data that was in the federal student aid system with tax data on income and earnings. And that meant penetrating the IRS somehow. So I was involved in setting up a meeting with the White House, Department of Education officials, Treasury, IRS, OMB, where we went into that meeting with what we thought was a solution, which was requiring everybody who got student aid to sign a consent form saying they would agree to let IRS give the Department of Education the data needed to do this calculation. We got to the meeting, and the IRS guys said, no way, we're not giving you the data. But a creative Treasury official said, do you really need the individual data, or you just need the aggregate data, like the median earnings by school for students who attend? And it was an aha moment for everybody who said, oh, we just need the aggregate data. And it completely flipped the design of the data match, which allowed for a sustainable program where the Department of Education pushes their individual student data over to IRS, the data gets matched, and IRS produces aggregate statistics that can now be posted on the Education Department's website. There's no privacy issue. So I think the lesson from this is you gotta get in the room with people. You gotta work it through. You have to have a higher cause that you're both working for. And you can make great things happen. So we're gonna hear today from our panelists. And so let me do quickly. And you can see more extensive bios in your packets. We have Dolores. Help me with your last name, Dolores.
Acevedo-Garcia.
Thank you. So she is from she's the director of the Institute for Child, Youth, and Family Policy at the Heller School at Brandeis University, and her research focuses on social determinants of racial, ethnic inequities in health, the role of social policies in reducing those inequities, and the health and well-being of children with special needs. We have Catherine Anderson, our private sector guru here. She's Senior Vice President of Policy and Strategy at UnitedHealthcare for communities and states. And there she spearheads business development initiatives that are consistent with the company's overall strategy. She has a background having national responsibility for shaping the policy agenda and positioning UnitedHealthcare as the preeminent leader in state and federal health programs. She does a lot of work with Medicaid, Medicare, dual eligibles, and special needs populations. Ross Santy is the Associate Commissioner for the Administrative Data Division at the National Center for Education Statistics at the Education Department. He joined the department in 2005 after launching and running something called Just for Kids in California, which maintained and hosted online reports about educational institutions. And then Mona Siddiqui is the Chief Data Officer, newly established position, I think, at HHS. And she is responsible for building and implementing an enterprise-wide data management strategy for the department. And prior to that, she had a wealth of experience working in the health world, both at NIH. She was on the White House Social and Behavioral Sciences team, leading their health work. So I'm going to start with some questions. So first question, and then I'm going to sit down. I'd like to start with giving everybody a chance to talk about significant achievements, some breakthroughs that might be inspiring to the audience. So Dolores, why don't we start with you?
Yes, thank you. Okay, good afternoon, everyone. So I'm a little different, I think, than the rest of the panelists. We are academic researchers based at Brandeis University in the Boston area. So we have had the privilege and the responsibility of developing a data system that is actually mission-driven. We have a very clear mission statement to develop and create research systems and data and knowledge that contribute to greater equity among children in the U.S. as the U.S. is becoming an increasingly diverse society. We invite you to check our website, diversitydatakids.org, which is the public face of the project. And we have a lot of different things that we could share with you, but I've chosen today to share our Child Opportunity Index. And there is a publication that is very nice because it's a very nice presentation of applications of the index in cross-sectoral collaborations, exactly the topic of today. It's this publication, and there are a few of these around that you can please take and read more about our work. So a few years ago, we set out to develop a comprehensive data system of children's neighborhood environment. We have heard today that neighborhoods are a very, very important factor in child development and health. So we realized that there was an important data gap, that we didn't have any system of knowledge about what conditions and resources children are facing in neighborhoods, conditions that they need for healthy development. So we created a comprehensive system for the 100 largest metropolitan areas, 47,000 neighborhoods in the 100 largest metropolitan areas. And what is nice is that the index itself is multi-sectoral because we have 3 domains in the index: education, health, and socioeconomic opportunity. In addition to being able to map the neighborhood index for each of the neighborhoods in the metro area, you can also take the population data for children by race, ethnicity, and see where children of different racial and ethnic groups live in relation to opportunity in the metro. So that is in itself, I think, an achievement because this system is being used across the country. But most importantly, we produce this data to create impact, to make a difference in children's lives. And what we have seen, and we are very proud of this, is that the data have really taken a life of their own. We are seeing people across the country in education, health, other sectors, using the data, our data, combining it with their own data, and I'm going to be giving you some examples of that. But it's just very exciting that we definitely see that we have filled a gap in data needs and that people are just taking the data, running with it, and trying to create impact in their communities.
Great. Why don't we just go down?
Sure. Welcome. Thank you. I'm glad to be here. Is that not on? There we go. Thank you for the opportunity. In education, we have to deal with the fact that the federal government really does not govern anything in education. We give out a lot of resources, we set some policies, but really it's about 16,000 school districts, 56 state education agencies, and somewhere around 7,000 post-secondary institutions that really determine what they're going to do and how they're going to deliver education. And for data sharing, this makes the first problem that for a lot of instances, you don't even necessarily know what you might have in common with an education agency that's not too close or not too far away, or possibly on the other side of the country. And so we've been spending the last about 10 years really trying to get into place some common data standards in education. And these are not a requirement. These are a voluntary set of elements and dictionary options to really establish and bring transparency to the phases of education data. And we've kind of all known for years, yeah, there's a thing called a graduation rate, but how's your graduation rate different than their graduation rate, and a few other things, and how exactly are you going about calculating it? The elements that you use and the algorithms you might put those elements through create very different numbers. And so bringing that transparency and helping people understand what data are being managed inside state systems, district systems, post-secondary systems has been the first thing. It's created a consistent language upon which we can have these conversations so that you don't spend 6 months of going round and round thinking you're talking about the same thing and thinking that there's an opportunity for data sharing, only to then discover, oh, no, we would actually need it defined a little differently, or we would need something in a different space. And so from the federal perspective and from the point of view of the National Center for Education Statistics, where I work, what we're trying to do is enable that conversation out in the field and help people realize that there's a lot more commonality to all the data that are being managed than there are dissimilarities. And so it's a matter of helping people understand, you may call it X and I may call it the number 3, but we actually are talking about the same thing. We actually are storing the same piece of data, and we could do something with that. And we've seen states start to come together in terms of, certainly this started 13 years ago when Hurricane Katrina hit New Orleans, and students moved, families moved, and suddenly the question was, where did all the kids who used to be in New Orleans public schools, where are they now? And states really had to work and figure out how to work together to understand who the students of New Orleans public schools had been and where they were now. And states have picked up on that, and certainly as they think about K-12 into post-secondary, how to make sure the educational history isn't being lost when somebody changes from one phase of education to another. Having some data standards in place has really given people a better language for that conversation that was ever in place before, and it's opened up people's eyes to what is possible, leaving some of the privacy issues to be discussed later.
When you first asked the question, the first thing that popped in my mind was huge success in getting our attorneys from a 200-page data sharing contract with external entities to something less than 100 pages, which was no easy feat. But I do think it speaks to an evolution, particularly from our organization, of the thought of how to use data in a way that impacts our members and the communities in which our members live, and not put at risk their privacy and the important healthcare data that we hold with great privilege. And so we have come a tremendous way in terms of our thinking about data and how we can use that data to create meaningful partnerships in the communities to improve people's lives. A great example of that is starting to take data, de-identifying that data, and then matching it against other available data sources, mostly social data sources that really help us understand what are the driving factors behind what's happening from a healthcare perspective. We know, and I know all of you in this room know, that anywhere between 60 and 80% of the healthcare costs are attributed to something other than the clinical interventions that individuals seek or are part of their lives. And so in order to really truly improve healthcare, you have to start to understand the different things that are impacting them from a social perspective. And because of that realization and the ability to start to think about the use of our data in a different way, we're now able to look at partnerships differently and being able to provide data to partners in a way that doesn't put our members at risk, but lets us pinpoint where we could put clinical interventions and supports, where we could make strategic and tactical investments in a community to improve the community housing issues, employment issues, transportation issues, and also then to create a layer to what we do on a regular basis of predictive modeling. So when we have healthcare data, we are on a regular basis looking at people's interventions from a healthcare perspective and trying to anticipate what their future interventions will be. We do that with pretty good accuracy from a healthcare perspective, but it doesn't take into consideration really the social data. And so now we're layering on social data, both in terms of individual consumer inputs, but also in matching readily available data sources in the community for us to be able to say what are the social influencers that are going to influence how people are going to interact with the healthcare system in the future. And if you can play that out and imagine what that looks like, that allows us the ability to not only focus disease management capabilities in certain communities, but really start to solve for the problems that are influencing health in a negative way, and to turn that trajectory to a place where we would have future positive implications for a single individual, but more importantly to a community.
So I think the biggest success for HHS has really been the culture shift that has happened over the last 8-9 years. And people like Kathy, people like Todd Park, who was the first CTO at HHS, who are really the champions for open data, I think set the stage for a lot of the work that is happening now. But I think not acknowledging the immense amount of work that has gone into creating that culture shift would be a big mistake. You know, we have a history at the department now of releasing over 2,000 data sets for public use. And the question really came up for a couple of different reasons. How are we using that data internally? So we've created this platform, healthdata.gov, and it was really intended for external users, for entrepreneurs, and for researchers to help us solve problems. But how is HHS using its own data? And the answer is obvious, not very well. We are a collection of 29 different agencies, each of whom operates in its own statutory authority. Each data asset is often comes under different regulations. And as you all know, when it comes to data sharing internally, the process can be as labor intensive as it was for me on the outside navigating a data use agreement with HHS that took over a year. And the experience can often be the same for two different agencies within HHS trying to share data. And so the end result is that we collect an enormous amount of information and we use it for the primary reporting purpose, but not really for any secondary use cases. And how do we start to change that? So it was interesting because of a lot of the open data work, I think there was a history now in the department of talking about data and using data. And after the OMB memo came out early on last year around asking departments to be more effective and efficient, The response from HHS was really to convene for 3 weeks, leadership and staff, really nonstop for 3 weeks, that's all people did, around 10 different work groups. Those work groups were around science policy, R&D, other topics, but the one common theme that emerged from each of those work groups was that HHS is data rich and information poor. We're not using our own data assets. And again, that is, I think, reflective of the culture change that has happened over time and gave us the impetus to do what we wanted to do next, which is start to create an infrastructure for the department where we have a governance structure that is about facilitating data sharing. So the people, processes, technology needed to have in place to start to have more seamless, accountable, transparent process for sharing data. That's actually, I think, the biggest success, the fact that people recognize it and that there are resources that are getting devoted for this work. For me, that is sort of the biggest success, when you can actually get both, staff level to leadership level support where there's consensus really across the department. Now, not everybody wants to share data, but everybody agrees that we need a process. So that's the first step. Just to sort of tell you where we are in that process, we have fanned across HHS, across the different agencies, and done our initial assessment of where the agencies stand when it comes to data sharing capacity and their strategies moving forward. We're not doing a landscape analysis of all data assets, which would take us 5 to 10 years. We have identified high-value data assets, which is a subjective assessment, but what we have done is, based on the data assets that are most frequently requested by other agencies, we've taken a deep dive on about 30 to 40 data assets at HHS to understand the technical, legal, and cultural barriers to data sharing. And that process is coming to a close in the next 2 weeks. Has spent between 5 to 12 hours at each agency, so you can imagine the amount of information we're collecting. We're collecting data use agreements across the department that have never been looked at really in one go, and the differences and the ways in which we're interpreting the same words. We're looking at state contracts that we're signing, and those state contracts can be very different depending on the states, depending on the agencies. So it's not only a comprehensive look at the capacity, but also the ways in which we're approaching data sharing. And this summer, we'll be building out that governance structure and then implementing that starting in the fall. So we're working on a very rapid, not at the pace of government, I would say. And hoping to, once that gets established in the fall, we're also developing use cases for basically testing how well that governance structure is working. So we know we can't address all problems, and we don't want complexity to basically not even keep us from starting. So we have identified, for instance, one will be around the opiate epidemic and how can we start to leverage HHS data assets where we bring together data, link data, and start to inform how we're thinking about policy. So really a shift in the way in which we approach policy making, resource allocation. I think creating an organization that is more reliant on evidence before it makes a decision. That's kind of the premise that we're working from. And really being able to use resources more effectively and efficiently. I would say this is going to be a 15 to 20 year journey, and we are creating that foundation right now, which I think is a success in and of itself.
So the next question we could spend the full hour on, but I'm going to have you just crystallize it. So what are the most significant barriers to improve data sharing, and more importantly, how have you overcome them? So why don't we start with Catherine?
People's interpretation of what's allowable to share. I think it truly comes down to, we hear HIPAA violation at times where that's clearly no violation, but there is a fear of sharing data, that is the base threshold you have to get past. And we've had to do it even within our own organization of really having our attorneys very clearly articulate in what instances can we share data, what kinds of data, de-identified versus individualized data, and how that data can be used. Because that's the other thing, because we, on our Medicaid data, when we're, as a Medicaid contractor, we're actually the guardian of the state's data. It's actually not our data. It's truly the state's data that we are responsible for managing. And so we have to understand that very delicate relationship with the state as well, and then try to translate that to whomever you're working with outside the organization to try to make sure that they have a similar kind of framework of what data can be shared, what are the parameters, and then how can that data, that specific data, be used. Once you can get to at least a common language, you can have a conversation of how to move forward, but without that common language or that framework, everybody says HIPAA and gets nervous and the conversation stops.
Mona, you want to take it next?
Significant barrier?
And how you overcome them? If you haven't already covered it, you've sort of painted a picture, so I don't know if there's anything to add, but.
So, I think there are so many. I don't know where to start, but I would say one, again, are the legal issues that keep popping up, and oftentimes, depending on which lawyer you get a hold of that day, you can get a very different interpretation. Interestingly, our lawyers didn't think that there was a problem in data sharing until we kind of talked to them about it. They thought that the process was working fine. And, I think that process was so sort of divorced from the user experience of data sharing that just bringing people into that conversation together to talk about what some of the challenges have been has been really important, and has gotten us the buy-in from our legal team as well. So yeah, I think those are barriers. But what I've also realized through, again, a massive number of hours of interviews with people is that there is just an enormous lack of resources. To your earlier point, Kathy, around people have their day jobs, and data sharing is an additional burden, which is absolutely a burden in many cases where there aren't enough staff members, there aren't enough resources to be able to address those sharing requests. So it's actually very easy to then pivot and say, well, we have all these legal reasons why we can't share data. And I think as important as sort of creating that governance structure, what I say, part of my job is to elevate the cause of data, and by that I mean we also have to devote resources to agencies who want to do this. And we can't ask people to do something and then not provide the resources to be able to do it. And so we have to be champions for that as well.
Ross?
Different arena, same problems. Legal uncertainty. We've had lots of conversations with states over the years, and even seen it inside the department, where the people who did not want to do data sharing knew all they had to do was say FERPA violation, which is the education records law, and suddenly everyone would be like, oh, well, I guess we can't do it. And you'd walk away, and 6 months later, somebody would try again. So we've been, for 7 years now, I think it is, we've had a privacy office at the department whose primary focus really has been outreach, and it's been about providing, guidance and clarification on some of these things to help people realize, correct, you can't just give an education record to anybody, but you can give them to some people who have the right and have the role that they are playing where it's appropriate. And so what are those things, and how do we get beyond that legal uncertainty? Because for so long, the people who did not want to share or just felt it was going to be too much work have used it to stop the conversations.
Yeah, well, first, we are also users of federal data, so I've been on the other side of that barrier many times, and I don't really want to talk about that today. That's not a good place to be, but what I want to talk about is, again, we are a little different. So our process for thinking about how we generate data for impact, we have given it a name. We call it the Data for Equity Pipeline. And what we mean by that is that we really want to engage with people from identifying what are the data knowledge gaps for understanding equity patterns, to generating the right indicators for assessing equity, to analyzing them, to engaging with users, and finally putting the data in the hands of policymakers, narrative makers, people that are going to be able to use it for impact. And that whole process, we've always followed it, and we realized that it was very much organic, and then we decided a couple of years ago that we needed to make it very explicit and make sure that people understand, as you were saying, that sharing data and engaging with people to use data is a lot of work. So we as academics are funded to do the data mining, the analysis, the peer-reviewed publications, but the power of the data is not that. The power of the data is that there are a lot of people out there that want to use it to create change, positive change. And we have to engage with them. So we don't always have enough technical capacity to do that, in the sense that we have a lot of technical expertise, but we don't have enough people. So I think a barrier that I see is that we engage with primarily users that have some degree of technical expertise. So what I'm worried about is that we are leaving out people that may have incredibly interesting questions that could be addressed with our data or similar data in their communities, but they don't have that technical expertise to do the work themselves. The power of our data is that it allows us to analyze equity patterns at the population level, but it's most powerful when we can combine it with individual level data that people have. And for us, that's not a problem, because what happens is that they get our data, they combine it with their own, so there are no privacy concerns, and then they put out these wonderful analyses that show, for example, the patterning of health outcomes or educational outcomes in relation to neighborhood opportunity. So we engage with them. It's a collaborative process. It's a partnership. I think Steve was saying before, it's data collaboration. It's not data sharing. And we have to understand that process as a relationship building process. Otherwise, it just doesn't work out.
So that's a good lead into my next question, which I'm going to, I guess, have Ross start off with. So what do you think of as the key characteristics for successful data sharing partnerships so that they endure, adapt to changing information needs, rather than become this, it's a one-off project that then everybody goes back to their corners and it never happens again?
Yeah. Well, you stole all the thunder by talking about the Social Security Administration and federal student aid for college scorecards, so I won't go there again. But what you settle on and hit on with that one really is it's in finding the benefit on both sides, right? And that's the thing. And what are the long-standing benefits? We've been building a partnership over the past 3 years, a stronger working relationship with the Department of Housing and Urban Development that really started around departmental performance metrics. And this was related to things like how many people living in housing agencies are filling out a FAFSA and submitting for federal student aid to go to post-secondary education, right? That's a great question that neither agency could answer independently. And so by getting together and talking about the relationships and what would it take to get that in place, we were able to start a greater conversation, but it also led to other things where, because we were having that conversation and because we were recognizing the mutual benefit that each agency was getting, somebody in one conversation started talking about, well, what about local school districts and housing authorities, and how can they share information? And so we engaged the privacy office, we engaged the people helping develop statewide data systems, and put together some guidance for the field. It wasn't about the two agencies, it was about the two agencies trying to do something to help the field, to say, here's something that you could do. If you're working as a housing authority and you're thinking about educational benefits you could provide or services that could help your local school district, or you just want to know what could we as a housing authority do to help this community a little bit more, where could we go? How could we build some information? And so we, again, tried to take away some of the legal uncertainty, clarify what kinds of sharing could be done. And we know there's been some great partnerships growing up in the Seattle area and a couple others. And I think the reason I'm sitting here today is because I was on a webinar about a month ago that I think some of you at least were listening in on. And, we've grown something that started from, we've got to do that performance metric. How do we get it done? Both agencies started to see the benefit and how the people we serve out across the country would benefit from greater work together, and tried to build and clarify where we could and enable people out in the field to do what they know locally is what they need and the right thing to do.
Great. Anyone else have anything to add to that? Insights?
Yeah, I actually want to share an example. I think that always helps. We have a lot of different users of the data, and that has been incredibly positive to see the demand for our data. A wonderful example that helps me illustrate some of the ways in which this can happen is the Chicago Department of Public Health. When we first released our data, we published an academic paper in Health Affairs featuring some of the findings from our first analysis of the Child Opportunity Index. People in the Chicago Department of Public Health that we didn't know about read the paper, and they were very engaged in developing their health equity plan, public health plan for the city that is called Healthy Chicago 2.0. So they got in touch with us, and they said, we need data, a neighborhood environment to correlate with health outcomes. We want to present a picture of social determinants of health at the community level and health outcomes. So I think the first element is, in our case, to have a common mission. People have talked about mutual benefit. That's one way of looking at it, but I think that our collaborations have been successful when we have had a common mission of equity, and very particularly child equity. So they took the index, they merged it with their own data, they used it for the plan. They found very important correlations, such as lead poisoning rates are twice as high in very low opportunity neighborhoods in Chicago than in other areas of the city. They also used it for defining eligibility for planning grants that they gave to nonprofit organizations to work on health issues in Chicago. They also decided that they wanted to augment the index by introducing a trauma domain that we don't have in the index. So they wanted, being Chicago, they were very interested in violence, in crime, so they discussed with us the technical aspects of adding a different domain to the index. And we collaborated with them all along. And then they decided to also engage other people in the health sector, so the Lurie Children's Hospital in Chicago ended up also using our index for their needs assessment. And they also shared it with transportation and planning agencies in the city. So they have now taken the index, and they are in turn propagating the value of the data and engaging more people themselves. And I think that those are some of the elements that I see for successfully being able to spread this data that are useful for some communities.
Great. So I think we covered HHS pretty well. I'm curious, Ross, whether you have anything more to share in terms of the education department, in terms of its role as far as enabling data sharing across programs.
Sure. As I mentioned, we're trying very hard to clarify and enable, and we are leveraging and building off of things that we're doing. And so, the common data standards are one piece to try to help put a common dictionary out there and get people recognizing what's being managed. But as soon as we did that, an interesting offshoot that came out of that was a lot of states started working together on some things, and one program office at the department started helping out with this to say, oh, well, you know what you have to do with that data? You have to package it up, create some aggregates, and move it to us. So can we standardize the way you guys do that? Here's some ideas. And so it's led to something that is automating that really boring task of federal reporting and bringing greater consistency to what we need, which are statistics from each individual state on how different program implementations are going and things along those lines. So as soon as you do that and you start thinking about moving data from system 1 to system 2, aggregating it together, you've done some things that can be used for a number of different purposes. And so how do we package that up in a way that it becomes a resource anybody could pull down and use for their own things? So we're partnering, sort of unofficial partnering with groups like the Michael and Susan Dell Foundation, who've been working on a way of moving education data from agency to agency and from system to system and presenting it through dashboards called EdFi, so that it's all open source. We can put some other things alongside of that so that people have got more resources and more tools available. If what they want to do has nothing to do with federal reporting, but it happens to use the same elemental data that eventually makes its way into federal reporting, there's some stuff to build off of. They're not just sitting there figuring out from ground zero and that blank sheet of paper or that blinking cursor on a screen trying to wonder, how am I going to get this started? There's something that they can pull down and build off of. So trying to, as we clarify the things we need for our job, how do we turn that into an enabling agent for the rest of the country to do the things that are more important to them and more immediate to what they're doing?
Do you have anything to add, Mona, or did you cover your stuff earlier?
So in addition to engaging in the work that we are within HHS, I think, to your point, there is a lot of work to be done in connecting with states. So much of the data we are getting is on a volunteer basis from states. The role of chief data officer, interestingly, is coming up more and more in states as well. And so we're looking to also see how do we start to engage with that community and see what the needs are at the state level and create a more bidirectional relationship.
That's great. All right, lessons from the private sector. So, Catherine, it would be great to hear a little bit about your practice and the, obviously you have an enormous amount of high-value data on disease prevalence and healthcare utilization, and just what are the lessons on how you use that to support your organization's mission, and what can we draw from that in terms of how government might work?
So some of you may have been in rooms when I've said this before. It tends to make people nervous. We have healthcare data on one of every 2 Americans. We sit on a tremendous amount of data. Not all of it is complete data, just because of the kinds of coverages we may have with individuals both in the private and the public sector. But what that does is we have lots of data. We do. We have incredible, mind-numbing amounts of data. And one of the biggest challenges is then how do you use that data? You know, we're very proud of the quantity. It's just then how much of it is actionable, and how can we be smarter about using data to really improve individuals' lives. So we have become, I think, very intentional over the last 12 to 18 months of using targeted data to look down to the community level, to understand what's happening in that community, and try to provide resources, both clinical and non-clinical, to improve the outcomes for individuals. We are in the process of a partnership with CLPHA as an example of that, and looking at 5 public housing authorities where we know we have membership. We can identify where our members are sitting. We can also identify their disease states and their chronic conditions. And then how can we partner both at a community level, perhaps bringing in, as an example, diabetes management that the entire community could benefit from, the entire public housing community, I should say, and how can we partner on the individual member level to have more intentional interventions with case managers or community health workers. That work is just starting. We've done site visits and are excited to partner. Like I said, we're targeting with 5 public housing authorities to really dig into specific communities and figure out how do we target bringing assets and resources in a meaningful way. Another example we did recently in partnership with another association was to look at primary care delivered in federally qualified health centers versus primary care delivered in non-federally qualified health centers. And what's the difference? What are the differences in outcomes? What are the differences in quality? What are the differences in intervention? And how can we create best practices so that regardless of where a person gets their primary care, they should have an equal opportunity to incredibly good outcomes. And so that lesson, and this gets to the earlier point, where we can, we think in the relationship with CLPHA and this other example, where we can demonstrate value to both partners, that the partnership and the use of data is important to both partners, we think that we have a stronger likelihood of maintaining and growing that collaboration over time. It's certainly proven true in the work for the FQHCs. Now there's ongoing work about figuring out what are those best practices that could be scaled and replicated if only people knew what they were.
That's great. Okay, Dolores, the Opportunity Index. You've told us a bit about it, but it would be great to hear more about what the lessons are in terms of how communities can get access to data, utilize high-quality data. What can people in the community level take away from the experience you've had?
Yeah, well, first of all, I think that a very important part of our project is that the data are publicly available. But of course, it's a challenge to make sure that people know about the data. So we do a lot of outreach trying to go to different conferences and policy meetings and just talking to colleagues to make sure that people know about the availability of the data. What we have seen is that there is definitely a demand for neighborhood-level data, and we've seen it throughout the conference. A lot of people have talked about mobility, have talked about CHEDI, have talked about using the CHEDI index, using other neighborhood opportunity indices. So this is definitely a growing field. And how do we make sure that we engage with people in a way that is going to create positive change in communities? I think that the main thing that we have learned is that the data collaboration has to be around an end goal of impact and around building a story that describes how children are facing inequities that are very detrimental when they don't have access to opportunities for their development. So we engage, for example, with a reporter from the Boston Globe, David Schaffenberg, that was very interested in describing patterns of inequity in the Boston area. He had written a very nice front page in the Boston Globe about increasing income inequality in Boston. And he was very interested in the issue of the distribution of subsidized housing in the Boston area in relation to opportunity. And he had some sense that there were data about neighborhood environment and that they could be merged with housing data, but he really didn't know how to go about that. So we met with him and we developed the data, the maps, analysis for him over several months. But most importantly, David is not any reporter. He's a reporter that is very equity-minded, and his whole career has been writing about income inequality and racial inequality. So we also work with him in developing a storyline. Of course, we did not control the storyline. He's a reporter that wrote his own story, but we were telling him about important issues to highlight when he was thinking about how to put together the story. The story ended up being on the front page of the Boston Globe, and it got a lot of attention from the housing industry, from people in the Massachusetts Senate, from other community groups that wanted to use the data in turn. So I think that the lesson is that we researchers, data people here, we have the technical expertise. We have a great ability, I think, to see what are the right analyses, but we have to scaffold that for people that are going to be using that. And a very important piece of that is, how do you tell an equity story? Another example of that, we wrote, this is a very technical, boring memo to HUD around the fair housing reporting requirements and the fair housing rule. As you know, there are obligations for the local housing authorities to report on segregation patterns in their community. And of course, families with children are a protected class. And our index is an index of neighborhood opportunities for children. So we wrote a memo to HUD saying, this is the way to use our index. And we would like to work with housing authorities, again, scaffolding the analysis for them, in some cases helping them a little bit with the analysis, and that's part of the process.
Great. So this is the Housing Is Summit, and most of you all are not from the housing sector. So I want to pose the question about what are the most useful cross-sector collaborations with the housing sector that you could envision, and what are some important questions that could be answered based on the perspectives that all of you have. So, Dolores, do you want to lead off?
Yeah, well, I would say that I am an honorary housing person because I don't work with the local housing authority, but my whole career has been around housing issues. From a very early academic age, I developed a passion for housing and the role of housing in being a platform for everything in life. And I've always been very interested in issues of housing segregation. So I already gave the example of someone in Boston writing an article about the location of affordable housing, subsidized housing in Boston in relation to opportunity, and the applications of our index, potential applications for the reporting requirements for the Fair Housing Act. But also, we have seen a very, very nice application in Boston that is very concrete. And I was talking to someone, Gail, from the Boston Housing Authority earlier. The Boston Housing Authority has had a pilot housing mobility program for a few years, and they work with a colleague that reached out to us to use our neighborhood opportunity index because they wanted to develop really a system for giving people, families, better information about neighborhood choices in Boston and facilitating moves to higher opportunity neighborhoods. So they use our index to develop an application that is now live online as of last week that allows families to say, my priorities in terms of neighborhood choices may be high child neighborhood opportunity, school quality, low crime, whatever that may be. I need X number of rooms. I need this rent level that is affordable for my family. So the app maps those affordable units for them, gives them the address. They can then go to a housing search engine and see the units and see pictures, etc. So that's a really nice application. The group is TAC, the American City Coalition, that has worked with BHA, the Boston Housing Authority. So that's a very concrete application. So we see applications from large patterns of inequality, analyzing for housing issues, et cetera, to very concrete applications like the app these people developed.
Great. So why don't we just go down the line?
Sure. I started my career as a history teacher, and I was working probably out in southern rural New Jersey, far from where, a lot of housing investments would be taking place. And the one thing that sort of is consistent from that, and I think most educators still feel today, is the things that lead to inequities, educational inequities, and therefore outcome inequities, you can't solve them during the school day. And they're looking for partners. Teachers everywhere are looking for partners. And you think about what's happening across the country in rural areas and in urban areas and everywhere in between. And how many parents are there and around and ready to engage to help their school districts and help their teachers, and as much as everybody wants to. So everybody out there is looking for allies and looking for ways to not just take something well-intentioned, but make it really strategic and aligned. And I think that's what a lot of people in education are trying to figure out there, because the challenges around inequities are not getting any easier. And so that, to me, becomes one of the great places where there are resources out there. And the problem I feel so often is, everybody's focused, to Kathy's point, you're focused on what your day job problems are. Well, how do we build the connective tissue across some of those things so the educators and housing authority personnel are working together a little bit better and a little bit more strategically than I think they are in most cases today.
Great.
You all know this, obviously housing is healthcare. Quite frankly, we can't solve healthcare issues if we're not solving housing issues. One of the greatest challenges for us, though, is that we have limited data sets on really people's real, true social issues, including housing and the risk of loss of housing for those folks who are housed. And so I think one of the greatest opportunities for us collectively is to think about how can we overcome reluctance to start looking at data in a way that matches what we know about people from a healthcare perspective and what many of you know about their housing status, and what others know about their homelessness status. That is one of the biggest opportunities I think we all have to make a compelling argument that will fundamentally change the way people talk about social services and supportive healthcare. Lots of people will talk about, we know it's important for people to have housing, we know it's important for people to not be living on the street in order to address their healthcare issues, but until we collectively work toward providing evidence to that public policy conversation, we're going to continue to say, yeah, we know housing is important to healthcare. So I think that's where the biggest challenge for all of us is how do we create that common framework? How do we work towards something that's common value, that will be mutually beneficial, certainly to us as a healthcare insurer, but also I think about those of you on the housing side. Imagine, if you would, that we would deploy resources to help stabilize individuals who may be having a hard time living in a unit, or who have first been in the unit for the first time for many years, being able to address behavioral health or substance use issues, and knowing where those are and actively engaging, rather than we sit back and say, gosh, I wonder why that person's homeless again, or I wonder why that person's in the emergency room again, and you all wondering what could be done to create stability from a healthcare side. So I think we have a collective mission that we all should embrace in order to really change the conversation.
Great. Mona?
So I'm also a physician by background, and I think anybody who's practiced either in a clinic or in the emergency department, to your point, will know that these issues are completely inseparable. It's interesting as we talk about doing more population health, we're actually not really paying for population health. Until we start to really link the data resources from housing and education and census, we can't get a holistic picture of a person's journey. The healthcare system, we say, is siloed, and I think the data systems are just reflective of how the healthcare system is designed. And I completely agree, we have to have a national conversation about what it is that we're paying for, because we end up paying for things so downstream when a lot of the upstream social influencers are the first indicators of what is going to happen for a patient in the next 5 or 10 years. So I think there has to be a fundamental shift, and I hope that from our reimbursement side that is something that we start to address in a more meaningful way, because we really haven't done much in that space yet. I did want to flag, we tried to connect data for our opioid codeathon that we held last December, and we brought in data not just from HHS, but from Department of Justice and Census and Education. We weren't able to bring in data from HUD, although we would have really liked to have had that. And so, again, looking at how can we start to establish relationships that are beyond a single use case, that are more long-standing with other federal departments where it makes sense. I think that is really the next step moving forward.
Great. So in a minute, we're going to have questions and answers, but I just want to see if anybody has some burning point that we missed in the questions I asked, or you were able to, any closing thoughts before we turn it over to folks? No? Okay. All right. Questions. And I hope there are some. I just want to just observe that in looking out at the audience, a very low rate of people looking at their phones. So I'm learning a lot. I hope they are too.
Kent Watkins, American Academy of Housing and Communities. Thank you for this wonderful focus on all the ideas that the panel has given us. I would like to throw out a question that might be taken up later in the breakout sessions involving big data. And it's a case study in which we ran a demonstration at the New York City Housing Authority under the old CHIP program. And now with the new 10-year authorization, I want to throw this out to the panel as to commenting on what we might do to overcome the data problems that we had there. 750,000 children impacted through the NYCHA public housing and assisted housing universe. And we had a terrible time making any matches in terms of even basic addresses involving then the data person up in Albany, Maximus, who was the contractor for the CHIP data up there, and who would decide on who could be enrolled and who was already enrolled and so forth. So I wonder if CLPHA also, you mentioned the 5 Housing Authority demonstration, whether something like that might be addressed, and see whether we tried to do it in a bunch of Hope 6 places out in Oakland and others throughout the country, but NYCHA was our big focus. And now that, as I said, we enter this 10-year new authorization of CHIP, how can we partner with housing authorities to better that data question that I brought up? Thank you.
Anybody have some reflections?
So it really is going to come down to, I think, some local community collaborations, quite frankly, rather than big state or federal data sets, because a lot of, from our experience, and I know you know this, the data is volatile in so much that especially low-income individuals are not stable. They don't live in the same place. They don't maintain the same phone number. That is a challenge that we have on a regular basis. I do think that some of the things that we deploy to overcome some of that, to find people, because that's part of our responsibility, is to actually find them, figure out where they are, how they're accessing services. That is done really on the street, literally, with community health workers and others. And so I do think that there are some opportunities to think about programs, whether it's CHIP or other programs. Again, this kind of goes to what we're trying with these 5 public housing authorities that I would love to see replicated over and over again. One of the biggest challenges is that we're not the only insurer in any marketplace. So you're getting only a portion of the individuals, and that creates some challenges. But I do think in some states, New York's a great example where there is a very robust insurance association, that there might be an opportunity to elevate data to beyond the insurers to some collaborative setting and to create relationships at that level. Otherwise, you're dealing, and in New York, there are many insurers that you would have to deal with, and that creates complexity.
I just want to add one point in terms of the technology, too, that there was a time, 10 years ago, if you were doing matching in the federal government, you needed name, date of birth, and address. And if it didn't work, you didn't have a match. And the private sector and census and others have developed probabilistic matching now. So you can understand so many other things about the individual, back again behind the firewall, but you can figure out that this person who had this name 5 years ago is the same person who has this name now, and do matching you couldn't have done before. So I hope states will do the same thing.
So I'm from HHS, and I did a nice data match project with HUD, and we actually did link successfully Medicare and Medicaid data, and the match rate for head of household and older adults was just fine. So I think in this case, this might be a case of looking at the children for whom the data might not be as good and linkable. And so that might be a time where we consider looking at the parents and their health insurance status. But just so that everyone knows, we were able to link HUD administrative data, picks and tracks, to Medicare and Medicaid claims data, and it was fairly successful. It was fine. So that's doable.
Hi, good afternoon. This question is mostly for Ross, but anyone else to chime in. I'm Christina Dukes with the National Center for Homeless Education. We're a Department of Education TA center. John McLaughlin is your program contact at the Department of Ed. He's here as well. The question is, so we're kind of on the front end. We provide technical assistance at the federal level to SEAs, LEAs, and also about cross-program partnerships, including HUD-funded youth homelessness demonstration program sites. There's a lot of interest in cross-systems data sharing on the front end, like have read your integrated data systems guidance. In the guidance, it mentions sort of acceptable use cases that meet with FERPA exemption requirements and others that don't. Ross, could you just speak a little bit to maybe other use cases that would be acceptable and would meet with FERPA exemption requirements?
I'm not a FERPA expert, but I play one in my job. And I say that just to mean that there actually is an office that's very focused on that. And up until a month ago, we actually have had a chief privacy officer who was focused on a lot of these things. We still have a staff there, but right now the chief privacy officer position is vacant. So I know that they've put things together. And I do not have the legal background to sit here and tell you what are acceptable FERPA examples beyond those or not. I do know, and I will say that office has been trying really hard to work with HUD on one side, HHS on others, on what are the guidance documents we can put out that speak to places where you could do a data sharing that crosses sectors that doesn't violate HIPAA or FERPA, doesn't violate FERPA and some other privacy law that's out there, and those types of things. So I will follow up with Michael Hawes, who's the primary person. You may have already reached out to him on some things, but he's the one who could really look at the field and understand what's out there beyond what we've already put in some guidance documents that might be acceptable examples. But so often it does come down with FERPA to the role. What role does that person play in that student's education? And if they don't have a formal role, as well-intentioned as they are, often FERPA is going to become a problem, and that's part of the challenge. So who's out there acting on behalf of the school district officially that does have a role? Those are often the types of things that come into play, but Michael's the one who can give you a lot better information, so I'm happy to get you in touch with him. Sure. Or you can just come to my session at 2 o'clock. There's Michael. Hey, didn't see you. Saw John, but I didn't see you.
So I think we have time for one more question. One more question. All right, over here.
So, kind of building on what you just said, you guys have cracked the code on how to get the data sharing agreements in place. I think most of us in the room have been working on a form or a contract or something, and while there are jurisdictional issues related to state and role that you play, it would be awesome if you could make some of the boilerplate ones available so that we can see what the issues are that have already been cracked and potentially either revise and refine our own data sharing agreements so that we can get better success in working with different partners.
I'll just jump in here. CLPHA, we're actually going to be working on a data sharing agreement for that boilerplate language. We're also interested in, especially with the health partnerships, we've done this on the education side, but trying to look at sort of draft MOUs, how do you structure the partnerships, how do you make data sharing part of that partnership and collaboration? So we're laser focused on that this year.
So what a great way to end this panel, right? Like there's a solution there. It's being, it's started, it's underway. And so I hope you all in your breakout sessions are equally action-oriented in anticipating and sharing ideas about how to move forward on this. So thanks a lot. Thanks to a great panel.
Yep, hand for our panel. Thank you so much.